Good day, Sir Melasmas. Today we are going to report about the framework for fortifying the security of San Antonio Medical Center, starting off with a company profile.
San Antonio Medical Center of Lipa, Incorporated stands as the vanguard of healthcare in Batangas Province, proudly holding the distinction of being its first private hospital dedicated to delivering top-notch pharmaceutical and medical services. Established in 1970, the institution has undergone transformative evolution. Initially known as San Antonio Maternity and Medical Hospital, under the stewardship of the pioneering U.S.-trained obstetrician gynecologist Francis N. Reyes and internal cardiologist Cesar A. Reyes Sr. Over the years, the hospital's commitment to excellence propelled its growth, culminating in its present status of the San Antonio Medical Center of Lipa Incorporation, a tertiary medical center offering a comprehensive array of medical specialty services and cutting-edge facilities. Under the leadership of Hospital Administrator Antonio N. Reyes, the institution has steadfastly pursued the mission to provide quality, affordable, and compassionate healthcare. The dedicated team of competent and committed medical staff and personnel adheres to sound management practices and leverages technology to deliver healthcare services that align with the highest standards. The hospital's commitment extends beyond medical care as it upholds a profound social and moral duty to the community. This is exemplified through its prioritization of affordable and compassionate healthcare for all, distinguishing it as a socially responsible healthcare provider.
These are the functional areas of San Antonio Medical Center. First stop is the patient admission. The patient admission involves three primary roles to fulfill its duty to the aforementioned hospital. The service desk mainly accommodates the patients and their medical-related paperwork. The doctor plays a simple yet significant role in this functional area. It is their duty to provide initial diagnostics that will be the basis for their admission. Furthermore, the nurse is responsible for assistance and execution for all the necessary measures that the patient will go through. Next up is the medical treatment, where the patient will receive the medical treatment required. The involved here is the doctor, nurse, and laboratory services. Next up is the laboratory services. For a detailed perspective, the laboratory service cycle also includes the doctor, patient admission, and laboratory service itself. The laboratory service main role is to collect requested samples, validate result, and relay the result to the doctor that uses it as a basis for their patient's diagnosis. The next functional area is the pharmacy, where the patients get their medications for their treatment.
For billing and finance, three major roles fulfill their responsibilities. Billing and finance is the one receiving and recording the services provided by the patient to process their available insurance with the help of the insurance provider and generate bills for the patient to pay. Once the patient settle their hospital bill, the billing and the finance department will produce patient clearance to be discharged. Furthermore, we have human resources, which is a functional area that involves manager, supervisor, employees, and HR within its cycle. The manager or supervisor is tasked in handling the hospital job opening, record performance feedback from HR department, and evaluate the workforce performance. The only role for the employees to comply is to attend and participate in training programs. Furthermore, the HR department recruits, interviews, and evaluates the applicants. For facility management, it involves additional help from both security and hospital staff within its cycle. Facility management is the one responsible for mandating hospital safety regulations by creating a checklist, employing security protocols, and evaluating security functionality. Moreover, the hospital staff make improvements to the physical safety of the hospital and also complies with the emergency procedures and drills.
Information technology, the most important cycle out of all mentioned functional areas, gathering all information encountered by the patient and as relayed by the healthcare provider. The IT department diagnoses the issue and resolves. After such a deliberate process, they have the second checking whether issues are still encountered, and the healthcare providers will again relay the problem to the IT support. Quality assurance. Once again, utilize both hospital staff and patient with its cycle. They gather all complaints from patient and conduct assessment that check the hospital standard healthcare regulations. If the hospital fails to pass the assessment, the hospital staff will fix the deviations. Then the QA will make the improvement to the hospital. Once they pass the assessment, the QA will actively monitor and gather feedback to ensure improvement of service quality. The patient acts as the verifier whether the improvement brought satisfaction to them. If not, then the QA will continuously make improvements again. Emergency response. The emergency response has the most meticulous recycle out of all the previously mentioned functional areas. Start by having an emergency occurrence that triggers emergency medical service dispatch and notifies whether the patient arrived admitted. The medical staff readies the medical treatment and gathers patient information. Support services such as pharmacy and laboratory are also present to separate conduct their assignment. The patient is the whole priority and it's important to know whether they need more medical treatment or are in good health and free to go. Patient's family also took part in case of patient unresponsiveness, so information and support can still be obtained.
Next up is data and information. This table contains the data and information relevant to San Antonio Medical Center, providing a comprehensive overview of key aspects. In the forms column, the details span various essential elements within each functional area. In patient admission, the medical history form captures critical health information, while the daily admission report provides a snapshot of daily admissions. Medical treatment involves a medication dispensing record and quarterly financial summary, ensuring meticulous treatment documentation, financial oversight. Laboratory services employ the laboratory test request form for accurate testing orders, complemented by the monthly patient census report for efficient service tracking. Pharmacy relies on the prescription form for medication dispensing, supported by the internal pharmacy audit checklist report for quality assurance. Billing and finance streamline processes with the billing and insurance claim form, overseen by the annual quality assurance report. Human resources utilizes the facility maintenance request and the incident report form and risk management report for risk mitigation. Information technology uses the employee information form and IT system performance report for evaluation. Quality assurance integrates the evaluation form and a general internal audit report. Simultaneously, the reports column aggregates collective data on product performance, comparative analysis, inventory management, expense reporting, and customer feedback, outlining the procedures associated with each report. This table serves as a valuable tool for San Antonio Medical Center, facilitating the tracking of admissions, treatment, laboratory, services, pharmacy activities, billing, human resources, facility management, information technology, and quality assurance. It aids in identifying trends and making informed operational adjustments for optimal healthcare delivery.
Next asset will be people, which are both the employees and non-employees. For employees, an organization's hierarchical structure is shown in the organizational chart above, with the CEO and leadership team at the top. Under the direction of the HR manager, the Human Resources Division is in charge of hiring, onboarding, and performance reviews. HR information system specialists and recruiters are among the specialists positioned in this division. The physical infrastructure, including housekeeping and security personnel, is the responsibility of facility management, which reports to the facility manager. The hospital's IT infrastructure is managed by the Information Technology Department, which is led by the Chief Information Officer, who's in charge with working with the IT support and security. Meanwhile, there is the IT director that leads the network admin specialist and the database admin. Moreover, with positions like pharmacy quality specialist and patient safety officers, quality assurance under the direction of the quality assurance manager. On the other hand, there's regular audits and technology support under the direction of IT and risk management. Both are responsible for guaranteeing the quality and safety of health. The flowchart shown above depicts the process and how a patient admission is conducted. At the same time, it shows the roles and job description of each mentioned personnel. Patients would be first be undergoing the patient admission area, which is then handled by the service clerk, which will then be followed by laboratory services under the care of medical technologists, medical laboratory technicians, pathologists, laboratory manager, and the phlebotomist. Moreover, medical treatment will be provided by the patient under the care of doctors and nurses, while medicines required by the patient will be taken care of by the pharmacist. Once the patient no longer needs medical treatment, the patient shall proceed to billing and finance, which are assisted by billing manager, insurance specialist, account receivable manager, budget analyst, chief financial officer, treasury analyst, and cost accountants. On the other hand, for non-employees, the uppermost level of this organization chart, which includes the leadership team and the CEO, is responsible for managing the structure of the healthcare company. Important departments, including patient admission, medical treatment, and laboratory services, are included in the functional area, while medical treatment is provided by independent contractors that specialize in certain medical services. Patient admission deals with the reception of those seeking medical attention. Laboratory services are contracted out to other parties. The relationship category highlights relationships with outside parties. like how finance and billing work with bank partners and how pharmacy gets its pharmaceuticals from outside vendors. Human resources manages personal issues, including interns, volunteers, and students in different roles. Facilities management is in charge of volunteers' contributions to the maintenance of the hospital's physical assets.
Next is the software. Within the dynamic operations of San Antonio Medical Center, the presented table serves as a crucial guide categorizing an array of software applications deployed across various functional areas. In the realm of patient admission, the Electronic Health Record or EHR systems, Epic Systems stands out for its cloud-based platform, facilitating efficient patient record management, clinical documentation, and seamless interoperability with other systems. In the domain of medical treatment, the telehealth software docs that enable secure video conferencing, remote patient consultations, and electronic prescription documentation. Laboratory services benefit from Labware LIMS, ensuring sample tracking workflow, automation, and comprehensive reporting of laboratory results. The pharmacy utilizes Omnicell for medication dispensing automation, inventory management, and seamless integration with the EHR for medical orders. Billing and finance operations are streamlined by revenue cycle management covering billing and claims processing, patient invoicing, and financial report. Human resources leverage Workday for employee data management, payroll, recruitment, and workforce planning. The facility management employs Archibus for maintenance management, compliance, risk assessment, and space optimization. Information technology relies on Meditech and Epic systems for comprehensive hospital information systems, while quality assurance is enhanced by RiskWatch for risk identification and mitigation. This comprehensive categorization ensures that each software applications align with specific needs in areas such as patient care, operational efficiency, compliance, and analytics, and underscoring its significance in facilitating the seamless functioning of San Antonio Medical Center.
So the next one is the hardware. The hardware infrastructure of San Antonio Medical Center has been thoughtfully designed to support a variety of functional areas in the hospital. Large storage capacity, high processing speed, and redundant power sources on servers in the data center provide continuous operation and safe preservation of numerous medical records. Advanced security features, scalability, and high-speed data transfer are made possible by the network equipment, which includes firewalls, switches, and routers. Workstations are designed to meet the changing needs of medical professionals by providing sufficient processing power, portability, and centralized processing capabilities. These workstations can range from desktop computers to thin clients. For the increasing amount of medical data, storage technologies like storage area, networks or SAN, and network attached storage or NAS provide scalability and high performance storage. Additionally, specialized medical devices, communication tools like IP phones, and video conferencing systems, as well as security measures like surveillance cameras and access control systems, collectively contribute to providing comprehensive and efficient healthcare services at the medical center. The integration of high resolution printing, diagnostic image equipment, patient monitors, and advanced security features underscores the commitment to delivering top-tier medical care, communication, and data protection. The hardware infrastructure at San Antonio Medical Center is designed to meet the unique and demanding requirements of a modern healthcare facility, providing the necessary tools and technologies for patient care, data management, communication, and security.
The next is risk identification and assessment deliverable. Information Asset Classification Worksheet. Information Asset Classification Worksheet was used as a tool for organizing and measuring the level of security of each asset used for handling security in terms of information and data management and cybersecurity. San Antonio Hospital uses assets such as electronic health record, patient billing system, and security cameras as its main focal points of the worksheet. These assets are categorized as critical, sensitive, and publical depending on how important and sensitive each one is. The worksheet contains the handling requirements such as encryption, access control, and regular audits to ensure that the data is treated appropriately based on its importance. By addressing possible risks such as unauthorized access, data breaches, and system downtime, these resources help to simplify the challenging process of data security. In summary, the Information Assets Classification Worksheet offers a structured method for managing information assets, hence improving security. Categorizing components of an information system. The components of San Antonio Hospital Information System consist of servers, workstation, database, network device. The aforementioned components enable the hospital system to be more efficient and functional. The relationship among these pieces is critical and dependent on one another, with the hospital information system relying on external hard drive backup for data redundancy and security. Furthermore, the addition of security's camera to the network improves surveillance capabilities even more. The possibility of system failure, network breaches, exposing private information, and data loss are some of the hazards that come with interdependence. Maintaining the information system security, integrity, and smooth functioning requires careful and efficient management and mitigation of these threats.
Next will be the sample inventory worksheet. So their sample inventory worksheet, a systematic summary of the key resources in the infrastructure of the company is presented. For a complete overview of the system's configuration, the worksheet records relevant information such versions, which include both software and hardware requirements. These assets location, which include both network and physical locations, are recorded and provide information on the spatial distribution of important components. With its comprehensive overview of important assets and their pertinent characteristics, this inventory worksheet is a useful tool for enterprises, enabling efficient management and supervision. Next is weighted factor analysis worksheet. This healthcare institution is exposed to a range of moderate and high risks, mostly from outdated infrastructure, insufficient backup systems, outdated system protection, and the need for advancements in technology. It is essential that these issues are resolved in order to improve the facility's overall security and operational effectiveness. Next will be Rank Vulnerability Risk Worksheet. Rank Vulnerability Risk Worksheet measures San Antonio Hospital's vulnerabilities based on their severity and possible impacts. It draws attention to a serious security risk associated with hospital information systems, namely the existence of poor antivirus software. There is a high chance of a security breach as shown by the high likelihood of occurrence. Crucial consequence of this vulnerability poses, especially in a hospital setting where private patient data is kept, will only worsen. Unauthorized access could result from a security breach, threatening patient confidentiality and the standard of medical care. This vulnerability's overall risk rating is therefore classified as high. To improve the hospital's information system's resilience against potential cyber threats and solve its security infrastructure shortcomings, immediate attention and strategic approaches are required.
Following are the company's risk control strategies. First, under the category of defend, the policies used in risk avoidance. San Antonio Hospital has a policy for employees that they can only use the hardware provided by the hospital. This blocks the use of personal flash drives, hard drives, and other accessories. Sharing of files and documents also needs to be under the provision of the admins through shared folders. There are also precautionary steps that the hospital follows when releasing a certain patient's record. There should be solid proof that the request is authorized. There is also a procedure for the IT department to release records such as CCTV footage, and this includes getting permission from the HR and hospital admins. This is done to avoid leakage of sensitive data. In case of emergency data loss, there are also plenty of hospital hard drives that contains backups of the hospital files in case something unexpected happens. There won't be that much damage in terms of their documents. There is also limited access to the main server of the hospital. Most of the admins and employees only have access to their information system and not the main server itself. This makes it less vulnerable to security breaches. In addition, the technologies that are used to prevent exploitation of vulnerability. The computers in the hospital vicinity have entry-level antivirus softwares, firewalls, and Windows security installed in them. In terms of the hospital information system, user accounts have a module that allows them to lock and unlock to certain files to avoid leaks. For example, in patient data, a user records it and locks it. They are the sole holders of access to the file, which makes them the only one who can unlock this. This is very important as the hospital information system contains many sensitive and confidential records that need to be highly protected. The main server is not interlinked to other servers yet, so they haven't put much security on it, as adding third-party software to protect it makes it more susceptible to attacks. So this relies heavily on the computer's defense and the employee's decision-making. Lastly, the responsibility for security management at San Antonio Medical Center is primarily handled internally. The hospital itself oversees the implementation of security measures and provides training and risk control strategies to its employees. As of now, there is no external company involved in the provision of security management services or training for the hospital. The internal security team collaborates across departments to ensure the robustness of security plans and the safeguarding of patient data.
The next risk control strategy is transfer. Functional area or areas or companies that provide security management. The security management function at San Antonio Medical Center is primarily overseen by the hospital's IT department, implementing and maintaining technologies, policies, and strategies related to information security. Their responsibilities encompass defense against potential security incidents, disaster recovery, business continuity, antivirus measures, and the overall safeguarding of sensitive data within the medical center. Additionally, they are responsible for the backup and recovery of data information, ensuring the continuity and integrity of critical records. Operations used by experts in security management. Within the secure confines of San Antonio Medical Center, the commitment to safeguarding patient data and ensuring uninterrupted healthcare operations is a paramount priority. The intricacies of this commitment unfold through meticulously crafted security plans, incident response plan, disaster recovery plan, and business continuity plan. Before delving into the operational nuances employed by experts in security management of the San Antonio Medical Center, it's crucial to understand how these professionals contribute to the robustness of these security strategies. This exploration unveils the proactive measures and strategies employed by security experts in fortifying the medical center against the potential security incidents, disasters, and disruptions. Utilization by expertise. Security experts use the IRP as a guide to respond effectively to security incidents. They play a crucial role in the incident response team and are responsible for executing response protocols. Continuous monitoring and training. Security personnel leverage continuous monitoring systems to detect security breaches promptly. They also contribute to ongoing staff training initiatives, ensuring that personnel and well prepared to identify and report incidents. Next is post-incident analysis. Security professionals lead the post-incident review process, analyzing the response to identify areas for improvement. Backup and recovery methods. Security personnel ensure that the DRP's backup and recovery methods are effective. Planning and updates. The IT department aligns the DRP with changing clinical requirements, participating in regular updates and revisions. They document procedures and communicate protocols to ensure that DRP remains effective in safeguarding department files during disasters. Access control and security measures. Security experts enforce access control and security measures outlined in the BCP, ensuring that only authorized personnel, such as the department heads, have access to critical and confidential data on the primary server. Antivirus and security defenses. Security professionals are responsible for implementing and maintaining antivirus measures, including firewall configurations and Windows security features. Regular updates and tests enhances the server's resilience against evolving threats.
Under the category of mitigation, we have Incident Response Plan or IRP. The Incident Response Plan for the hospital is designed to ensure a prompt and effective response to security incidents with the primary focus on safeguarding patient data and maintaining the integrity of hospital operations. The plan begins with measures for incident identification, utilizing continuous monitoring systems and staff training to promptly detect and report security breaches. Clear incident reporting structures are established, fostering a culture of reporting without fear or of reprisal. The incident response team, comprised of IT professionals, security experts, legal representatives, and department heads, is tasked with executing response protocol, and regular training is conducted to keep them well prepared. A comprehensive communication plan is in place, featuring contact details for key personnel and outlining procedures for both internal and external stakeholders. Fortified data security. The hospital employs a robust backup strategy, ensuring the regular backup of critical data, including patient records and confidential documents. Training and awareness initiatives extend to regular cybersecurity training for all staff, emphasizing their role in maintaining a security environment. Legal and regulatory compliance is prioritized, with a plan aligning with healthcare regulation and data protection laws. Following any incident, a post-incident review is conducted to analyze the response, identify areas for improvement, and update the plan accordingly. Additionally, the hospital implements a thorough backup strategy, including redundancy measure, responsibility assignment, monitoring, and documentation. Testing and training efforts are ongoing, ensuring the plan's effectiveness, and there's a focus on proactive measure such as offsite backup to protect against physical disasters. Regular reviews and updates of the incident response plan align it with evolving technological, personnel, and organizational needs, effectively addressing emerging cybersecurity threats.
Under the Disaster Recovery Plan, or DRP, for the hospital's department files is a comprehensive strategy designed to ensure the availability and integrity of essential data in the face of potential disasters. In the event of a crisis, an appropriate recovery plan can always provide critical information in hospital department files. The strategy consists of several backup recovery methods. The first being regular backup of department files to external hard drive provided to each department head using network attached storage or NAS enclosures, increasing backup system redundancy and reducing the risk of data loss are in are in integral parts of the system. It is recommended that employees perform this backup on a weekly or monthly basis, depending on the importance of the file. Most importantly, the system keeps three backup hard drives for each room, allowing flexibility in the event of a hard drive failure. Department head supervisors are responsible for backup, supported by a monitoring system that confirms backup success and regular testing to assess system effectiveness. Planning to align the DRP and changing clinical requirements requires regular updates and revision, documentation of procedures, and clear communication protocols. In summary, this disaster recovery plan combines preventative measures, promotion, and clear policies to protect sensitive clinical information in an emergency situation.
For the business continuity plan, the thoroughly crafted business continuity plan for the management's primary server is designed to ensure uninterrupted availability and security of critical data. Exclusively accessible by department heads, the focus is on a strategic blend of access control, security measures, and incident response protocols. Access to the primary server is strictly regulated and limited to department heads with stringent access controls to prevent unauthorized personnel. Antivirus measures primarily rely on firewall and Windows security, with the option to incorporate renewable Avast antivirus solutions when necessary. Regular updates and maintenance are emphasized to strengthen antivirus defenses against evolving threats. A robust firewall and Windows security features further enhance the overall protection of the server. The backup and recovery strategy prioritizes data integrity and availability, incorporating regular testing and offsite backups for comprehensive resilience. A communication plan ensures swift notification of relevant personnel in case of a disruption. Additionally, a well-defined incident response plan outlines roles and responsibilities for an efficient and coordinated reaction to security incidents. The vendor relationship with Avast antivirus solution is highlighted, emphasizing proactive engagement for support and timely renewals. Regular testing, reviews, and comprehensive documentation contribute to the plan's continual evolution, addressing emerging threats and changes in the IT landscapes. In summary, this BCP is a multifaceted approach that integrates security measures, access control, and contingency plans to fortify the management's primary server against potential disruptions and security threats.
Thereafter is the security planning of San Antonio Medical Center, starting off with the company's information security policy, standards, practices, procedures, and guidelines. San Antonio Medical Center places a paramount importance on safeguarding information through a comprehensive framework that encompasses policies, standards, practices, procedures, and guidelines. Emphasizing robust data protection, the management has implemented a stringent information security policy. This policy highlights the critical nature of limiting access to confidential files only to individuals authorized by their respective department heads. By following this protocol, the organization aims to strengthen its defenses against unauthorized access and potential data breaches, ensuring the confidentiality and integrity of sensitive information. In line with the information security policy, San Antonio Medical Center has set standards that act as benchmarks for information information security practices. These standards are crafted to provide clear expectations and guidelines for securing data across the organization. Regular assessments and updates to these standards are carried out to align with the evolving threat landscape and technological advancements. This proactive approach enables San Antonio Medical Center to maintain a robust defense against emerging cyber threats and vulnerabilities. To facilitate secure collaboration and information sharing among staff members, the management has implemented a structured approach for managing office files. Shared folders, commonly referred to as temporary files, have been designated for this purpose. These folders are meant to serve as a secure space where authorized personnel can exchange data and information within the organization. This separation of access rights between confidential and office files reflects the organization's commitment to maintaining a balance between efficient data sharing and stringent security measures. The implementation of comprehensive practices, procedures, and guidance further enhances San Antonio Medical Center's information security posture. Regular training sessions and awareness programs are conducted to ensure that employees are well versed in the best practices for information security. These initiatives are crucial in fostering a culture of vigilance and responsibility, where each staff member plays a pivotal role in upholding the organization's dedication to data security.
The management's role in the development, maintenance, and enforcement of the company's information security policy, standards, practices, procedures, and guidelines. In response to government mandates, the hospital management has proactively updated its policies on its website, reflecting the changes brought about by the new legislation. Management has also adopted and revised the organization's processes and procedures to align with the requirements of Data Privacy Act. Recognizing the significance of these changes, management has undertaken training and seminars for both new and existing employees to ensure a comprehensive understanding of the new regulation. Through these initiatives, management aims to reinforce a culture of adherence to the Data Privacy Act, emphasizing the importance of following proper protocols in handling, sharing, and printing files to safeguard sensitive information. Government's introduction of the act prompted the hospital to update its policies on both its premises and website, leading to a significant overhaul in its processes and procedures regarding data management. Recognizing the importance of adhering to the new regulations, has instituted regular training sessions and seminars for both new and existing employees. Through these initiatives, employees are continually reminded of the protocols mandated by the Data Privacy Act, ensuring a comprehensive understanding of the guidelines governing the acquisition, distribution, and printing of files within the organization. The management's proactive approach underscores its commitment to upholding data privacy standards and underscores the significance of its role in safeguarding sensitive information by newly established legal framework. San Antonio Medical Center management plays a pivotal role in enforcing the company's information security policy. With the recent updates due to the new Data Privacy Act, they ensure employee awareness through training sessions. The policy prioritizes limiting access to confidential files, bolstering defenses against unauthorized access and data breaches. The management oversees regular updates to standards, aligning them with evolving threats. Security collaboration practices like designated shared folders, balance efficient data sharing with stringent security. Training sessions and awareness programs foster a culture of vigilance among employees, emphasizing their vital role in upholding data security. This approach highlights the medical center's commitment to mitigating costs, risk, and safeguarding data assets in compliance with the new Data Privacy Act. The management takes charge of aligning the organization's policies with the legal requirements mandated by the new legislation, leading to a comprehensive revision of internal processes. This includes a meticulous examination of how data is handled, shared, and printed. Management is actively engaged in disseminating knowledge by conducting training sessions and seminars, serving as a constant reminder to both new and existing employees about the significance of adhering to Data Privacy Act in their day-to-day tasks. By taking these measures, management not only ensures regulatory compliance, but also cultivates a culture of heightened awareness and responsibility towards data privacy throughout the organization, fostering a secure and ethical environment for handling sensitive information.
Next is company's information security blueprint and its major components. The diagram above shows how how a patient's record is handled while ensuring security and confidentiality. To summarize, requesting information about a patient's record can only be obtained through valid authorization and request letters. Moreover, San Antonio Medical Hospital cannot release the patient's information if he or she is a company patient. San Antonio Medical Hospital will directly send the patient's information to the certain company that the patient is a part of. For companies in institutionalized policies, standards, and practices using education, training, and awareness program. At San Antonio Medical Center, there are established institutionalized policies, standards, and practices that are intertwined with education, training, and awareness programs. These are made to ensure the organization's formidable information security as ensuring the safety of sensitive information is top priority. The institutionalized policies of San Antonio Medical Center covers a very crucial aspects of being able to establish information security, such as patient confidentiality, medical ethics, employee conduct, and many more. This is of course impossible without proper training and education provided to the workforce. Training programs such as workshops, seminars, and online courses which tackle employee conduct and ethics play a vital role in being able to uphold the institutionalized policies. Awareness programs also help give employees a sense of responsibility as they are fed with information of adhering to the institutionalized policies of the organization and the law, which is the Data Privacy Act. They are also educated about protocols which needs to be followed for various reasons such as information confidentiality and safety. San Antonio Medical Center is doing these support programs utilizing education, training, and awareness programs which aim to mold the best version of the organization's information security by helping the workforce comply with the institutional policies.
In conclusion, prioritizing and enhancing hospital security measures is imperative to ensure a safe environment for patients, staff, and visitors. That is all for our report. Thank you, Sir Dennis po.